Start recognizing all the folks in the media. Actually, you guys are doing an amazing job of connecting healthcare providers to the community and to provide the information. And I appreciate your work during this time as well. It's tough for everybody at this time with the front line or anybody else is doing it. So I think recognition goes to all the folks actually in the media at this time. So I'll start with some of the patients we're caring for in Hartford Healthcare right now. We have about 416 patients across acute facility in different parts of the Hartford Healthcare. 41 patients, 41 in Hospital Center, Connecticut, COVID positive, and 22 PUI. Midstate Medical Center has 30 patients and 17 PUI. Hartford Hospital has 206 patients who are positive and 29 PUI. Wyndham has 3 patients who are positive and no PUI. Bacchus has 11 patient positive and 6 PUI. Charlotte Hungerford has 18 positive and 3 PUI. And St. Vincent Medical Center has 107 positive and 20 PUI. As we have a large community network and behavioral health network, we also have 88 patients who are in group in our home care setting who are being monitored and who have positive COVID positive status as well. And 13 of them have been tested for PUI at the moment. Our behavioral health network has 4, as I indicated. Ours is probably the only system who have created a COVID-only unit. So we have a wonderful way of managing this really challenging situations in our COVID units as well. So overall, Hartford Healthcare is taking care of 508 patients across our system, including the community network and behavioral health, and 110 patients who are PUI at this time. We've talked about capacity and surge in past. We are not concerned about the capacity. I think we have a fair amount of capacity at the moment. As I've indicated earlier on, given this COVID crisis, our usual volume, which comes from other types of care, has obviously declined. So it allows us to open more beds, and we're doing very well with that across all the system. As you probably noticed that St. Vincent Medical Center and Hartford Hospital continues to run high numbers, but other parts of the organization has seen somewhat plateauing or similar numbers at this time. Regarding the surge, as we had talked about in our models through the MIT and Hartford Healthcare Collaboration, we had projected the peak sometime in end of April or early May. When I talk about the peak, I'm talking about the total number of active cases in Connecticut, and we're still seeing the rise. And I like to believe that on 26th, 27th of April, we will see the peak. Our hospitalization will peak around that time. We have seen increased activity happening from in Hartford County now compared to Fairfield County, and I think that we will see the trend as the disease move in different parts of the states. Our concern still remains in our assisted living and SNF population and group home activities, because we're seeing increased number of cases, as Governor's office have reported in the past, and that does create some sort of a challenge for us to plan this out. We might see increased activity happening from patients coming from those settings as we go forward. But I'm comfortable at this time that our healthcare system, Hartford Healthcare, and I think all the healthcare system across the Connecticut have really come together, planned very well, and the social distancing effort and other things we've done in Connecticut have really helped us in managing where we are. By no means the number of mortality we have seen is something what we were hoping for, what we are aiming for, but where we are right now, we feel comfortable regarding the state plan. We have talked about the testing in past. Our drive-through testing continues 7 days a week. We continue to have adequate supply based on our capacity at this time. We continue to explore different ways of expanding our capacity. And over the time, you will hear some more details on that. We had started the convalescent plasma donation and transfusion process. It has gone very well so far for 6 patients. We have more donations lined up. We've got a tremendous amount of response through our website, and I thank all the donors who are reaching out. That's very kind of everybody to support each other. We are, as I indicated in the past, we're partnering with American Red Cross, who's using the donation centers in Farmington, and Rhode Island Blood Center in Westerly and Providence areas. To donate to Hartford Healthcare teams for any PPE, our website is hartfordhealthcare.org/coronavirus. I do want to make a comment. We do need supply, especially the mask, the hand woven cloth made. As we're noticing that the increased amount of public who's actually coming to our organization do require masks. And it's a challenge for us to manage the supply chain, not knowing the volume would be using our surgical mask and other things. So we are using the donated inventory for supporting the patients primarily at this time. So welcome the donation. There's a lot of discussion about masking everybody, and it becomes a challenge for healthcare institutions to manage to provide that. We made some exceptions, and we provided in some areas, such as in the maternal area and the group home activities, and where the patients are unable to secure their own mask. We provided the mask from Hartford Healthcare side, but we're using predominantly the donated inventory at this time. So we'll continue to welcome some donation. We have capability of doing antibody testing in Hartford Healthcare. Our clinical and research team is looking into the appropriate utilization of that. As you know, the antibody testing still, there's a lot of research that's been happening, and we're learning about the science of that. At this time, presence of antibody may or may not indicate immunity. I think it's important for people to know. There's a lot of questions are coming up. We do not know whether if you have antibody in your blood, you're immune to a possible COVID-19 infection. We don't know whether reinfection occurs or not. We don't know exactly if you have a COVID antibodies as a healthcare provider, can you come back to work and be placed in a COVID positive environment without any protection. We don't intend to take any protection away. We want to make sure even our healthcare provider who actually has COVID antibody positive, if we test, they are fully protected at this time because the science is still evolving. These are a few of the updates I have from my side. At this time, I'm going to introduce my colleague, Charles Johndro, who's our medical director for ground EMS. He works as an emergency physician at Hartford Hospital. Thank you, Dr. Johndro.
Thank you, Dr. Kumar. So I'm Dr. Charles Johndro, the medical director of ground EMS at Hartford Hospital. Really like to break down my role into two large pieces. The first of which to be provide clinical direction and oversight of all the pre-hospital care delivered in our area. And this is to first responder agencies, police departments, EMS agencies, fire departments. That's role number one. The second and most important role during these times is to be an advocate for the work that's done in the pre-hospital setting. So I would like to take a minute to really thank the emergency responders that are out there providing fantastic care during these very trying times. Really wanted to speak to the collaboration between Hartford Hospital and EMS and some of the work that we're doing together. One of the biggest things that we're doing is providing some clinical leadership for slight changes in our response to COVID-19 and how they affect patients. That's very important. The second and also very important thing is to provide emotional support for the emergency responders during these trying times. Hartford Hospital has opened up COVID-19 testing for EMS responders, emergency responders, and they're treated and tested as if they were our employees, which I think is very, very important, and it shows our dedication and thanks. We also do very frequent check-ins with emergency responders, chiefs of service, just to keep open lines of communication and make sure that we're addressing all issues in real time. So just to talk about some of the precautions that we're using, in these times we're asking all emergency responders to take great care and caution and safety when responding into 911 calls. They're using personal protective equipment on all calls now, and I think this is very important to ensure the EMS safety. And as you know, we're still seeing non-COVID-19 emergencies. So strokes, heart attacks, traumas, all are still happening. So it's important that we remain focused on comprehensive care for all of our patients. And so that's just a glimpse into my role at Hartford Hospital and a little bit about what the EMS community is experiencing at this time. So I'd like to turn it over now to Dr. Matt Tichauer, who's the Director of Critical Care at Hartford Hospital. Dr. Tichauer.
Thank you, Dr. Johndro. Just a correction, Director of Emergency Critical Care here. I wanted to just go through the history of how the Division of Emergency Critical Care, which is under the Department of Emergency Medicine here at Hartford Hospital, came about, and how actually it prepared us for the current pandemic that we're facing right now. About 4.5 years ago, when I came to Hartford Healthcare, and prior to that, throughout the country, there was a noticeable trend in terms of increasing critically ill patients presenting to emergency departments. On average, about 140 million people frequent the emergency department every year. And of those, about 40 million have hypertension, 8.5 million have COPD and CKD, and there's a large amount with heart disease as well, about 8 million patients. These are the exact comorbidities that not only allow for worsening of disease, but also currently with the pandemic, we're seeing that lead to worsening disease with COVID-19. So at the time, we developed the Division of Emergency Critical Care in order to address this ongoing trend in increasing critically ill patients in the emergency department. With the support of the emergency leadership, as well as the critical care departments and the emergency nursing leadership, we developed a critical care lecture series for the nurses that has been ongoing for the past 3.5 years. We've taught multiple lecture series to the emergency physicians, as well as the residents training on how to address critically ill patients in the emergency department, so we can refine skills that we would need for a possible future surge, which we were expecting. This surge was understood to be due to an aging population, which we had seen from 2010, the first decade. There was an increase in about greater than 50% in those over 65, and that is a trend that's going to continue to grow till 2040 from 2020. And so this was a very important need in the emergency department, and it just so happened that we were ready when this pandemic struck with regard to our ability to address clinically. As the pandemic started to spread towards Connecticut, we realized that putting healthcare workers in the line or at risk was a priority to address that safety. And Hartford Healthcare actually did come through immediately with respirators for those providers who were involved in aerosol generating procedures, most notably intubation. Along with our anesthesia colleagues, the Division of Emergency Critical Care, we developed the CART, which is the COVID Airway Response Team, both an anesthesia and emergency division, in which we could address these patients who had respiratory failure, intervene with intubation, as well as do it in the safest possible manner for all people involved. Currently, the Bliss 1 ICU, we had opened, it was originally going to be the observation unit, and the Division of Emergency Critical Care, along with my colleague Christina Liu and our fellows, Arturo Frederico and Michael Chung, we have been staffing that along with the Department of Pulmonary and Critical Care to address the ongoing pandemic and patient population. And at this time, I will be opening it up to questions.
Any questions from anybody from the media?
Yes, Lisa, Dr. Kumar.
Hi.
The patients that have received the transplanted convalescent plasma, can you tell us when they received it and when you'll know something about their results or their outcome?
Yeah, patients received on Thursday evening and Friday and some on Saturday as well. You know, outcomes difficult to predict at the moment. All those patients who have received are doing either well or just about the same at the moment. So there's no deterioration, at least that's positive. Generally we see the response in 3 to 4 days time. So I did not inquire this morning how they're doing, but as of yesterday, at least a couple of patients had shown some signs of recovery. So I was optimistic about where we are heading with this.
And could you detail a little bit more about the need for masks? You'll accept even the cloth masks for patients that are coming in, did you say?
Yeah, so thanks for asking. As there's a demand in the community to wear the mask, as our governor and other people have mentioned. It's the right thing to do. I think everybody should wear a mask, but not everybody has means or capability of having a mask. So patients who are coming to a Hartford Healthcare facility, we're trying to see if we can provide some more masks to them. And we're using the masks which are donated to us, especially the cloth masks, and any other kind of mask which we're getting donation. We're using a lot of donation to giving to the patients and some of the visitors we have in our facility. And we're using, especially in some areas, such as if a mom is giving a birth and the husband or spouse or anybody else who's actually accompanying them, we're providing the mask to them. We're providing the mask to the individuals in behavioral health setting who are coming from group activity, which are required for their well-being and psychological improvement, and obviously in a social distancing setting. So we want to make sure they have the mask available. And some of the underprivileged areas, some of the areas actually who can't afford the mask, we want to make sure they have some access to the mask as well. So the more donation we get of that kind, it's much better for us to be able to distribute back to the community in an appropriate setting, especially those most vulnerable population who are interacting with the healthcare settings across the system. We're trying not to use our surgical mask or the masks which are required for the healthcare workers for those kind of activities, but we welcome any of the masks which are given by the community.
Dr. Kumar, Bridget from the Republican American, could you give a sort of a short explainer of the difference between the convalescent plasma as it is benefiting the immune system versus an eventual vaccine? In other words, the convalescent plasma would give a short-term boost to the immune system, right? And the vaccine would prevent the disease or kill it.
Yeah, it's a great question. So vaccines are the right approach of dealing any kind of viral spread and obviously any pandemic. And there's a lot of complexity in the vaccine discussion. You need X amount of percentage of population to be vaccinated to create a herd immunity. So the pandemic, the virus does not have a chance to proliferate or actually infect a lot of people, which leads to epidemic or pandemic. So vaccine is a right treatment, which we are far away from that. That is the one to prevent. It's a precautionary measure so that nobody gets infected, and we can reduce the spread of the pandemic. So vaccine is considered more of a precautionary measure, which is the right thing to do, and that's what we have conquered a lot of disease in past, as like measles and other things as well. The convalescent plasma is a concentrate of antibodies. So if I have a COVID-19 today, and if I recover and my body reacts appropriately, I would have some antibodies, and hopefully have an appropriate amount of antibody. If you take my plasma, which is an extract of the blood product, and give it back to somebody who's actually fighting the infection in a critical state, it allows them to a temporary boost to fight off that infection. Hopefully, gives the body a chance to recover a little bit faster. So that's the science behind using convalescent plasma. Convalescent plasma is not a replacement for vaccine. Vaccine is the right therapy for any viral infection, especially what we're facing like pandemic, or what we have faced in the past as well.
Thank you. And the vaccine eventually would accomplish what when we're talking about that same immune system? Would it block the virus or would it kill it? What would the vaccine do that the plasma cannot?
Yeah, so ideally what vaccine does is that if I'm a healthy individual, if I'm given vaccine, it allows my body to react and create antibody myself. And so next time when I'm exposed to an infection, I'm able to fight it off and prevent a worsening of the infection happening at that time. So vaccine is more of a prophylactic, precautionary measure, and that allows us to have a fighting chance when the infection really occurs. Convalescent plasma is a reactive measure. It's you already have an infection, you're fighting, and you're trying to boost energy. So totally different way of looking at things. Vaccines, as we have succeeded in, whether it's polio or rabies or measles or other kind of diseases like that, it exposes, depending on live or attenuated vaccine, to different types of vaccines. It allows the body to get exposed to that viral particle, DNA or protein, or sometimes a whole virus, and allows us to create the immunity while we are in a good state, in a healthy state. So when the infection comes, we can fight it off.
Thank you. That's very helpful.
You're welcome.
This is Aisha from Prop 61. Along those same lines, since you've just explained plasma and vaccine, where antibodies research and testing fits into all of that?
Actually, I want to make sure I understand your question correctly. Are you asking, are we testing for vaccine, or what's your question? Do you mind repeating it again?
I guess the benefits of testing for antibodies.
Benefits for testing. Thanks for asking.
Yeah.
Antibodies, so there's a test available to check whether we have an antibody. So if I am, hypothetically, if I'm infected and I recover, there's a possibility I might have had asymptomatic infection, or I might have had a symptomatic infection. So how do I know whether I'm protected, hypothetically, from future infections? So testing my blood sample for antibody tells scientists that I have had exposure to COVID-19. So if you take the healthcare workers, for example, the individual who working in the hospitals and other settings, if we test blanketly everybody, and out of 30,000 employees of Hartford Healthcare, we test everybody, and we have, let's say, 2,000 people came back as possibly having an antibody in the system, it could mean that those 2,000 people are protected from future infection. The challenge we have right now is we don't know the efficacy of that. We don't know what the antibody means for the novel coronavirus because it's so new. We haven't had enough time or research out there to advise that. So a lot of science, as we've talked about, is rapidly evolving. Next week, we might have a different information than what we have right now. But as of today, presence of antibody only tells me that somebody has been exposed to the infection. It does not tell me that you are immune to the future infections or of any kind.
Thank you.
Doctor, this is Brian Hollenbeck at the Day in London. Going back to the CPR testing, could you define once again what a person under investigation is, what their status is as far as testing, and also what's been the experience as far as what percentage of the CPR tests yield results that turn out to be false?
I think you meant PCR testing, not CPR. So PCR is a polymerase chain reaction testing. The way we do the two parts of the question. So the PUIs, person under investigation, is a individual who shows up, let's say, to a clinical area, the emergency room or our medical office buildings and all that, who have symptoms such as headache, such as shortness of breath, such as cough, fever. And so we consider those patients as possible COVID, but not proven because we haven't done the test yet. So we consider them as a person under investigation. The test is sent out, and generally there's a time lag by the time the text comes back. And after that, we know whether the individual is positive or not positive. And if they're not positive, they're treated as any other flu or any other infection. And if they're positive, they're treated as COVID-19. And that's the number I report out every morning. Right. So that's the one part of your question. The second part of the question, what you're asking, is what is the false positive, false negative rate of testing we do here? Now that's, I want to make sure you know that every single organization, hospitals, and the testing platform is very different. So what I mentioned, the number of Hartford Healthcare may not be the same for any other hospital or system because we have a different platform. We believe that our false negative rate is rather low in Hartford Healthcare, although there is a risk here. We've had some circumstances when we have tested individual first time around and they come back as negative. That we consider as a false negative because they actually did have some disease. When the second time we tested them, they came back positive. The percentage of that is extremely low. And I wouldn't be able to tell you exact number right now, but it's a very low percentage. But what we do here is because we are aware of this possible error if somebody has a high risk of clinical suspicion of COVID positive. Despite what the test came out initially, we sometimes retest them after a period of time, 24 hours or 48 hours time. Until then, we consider them as a person under investigation. And that's one of the precautionary measures so that we don't miss anything out. We like to believe that we've done a good job in managing that, and our testing has been very well validated. the way that before we release any kind of testing, there's a lot of validation goes on, comparing the studies, running the trials before we actually allow it to be used for the patients or anybody else. Similarly, we are in this, at the moment, antibody testing, we are in the phase of validating that. That's why I'm not very sure about commenting what that means at this time, because we are still running the validation study, and we will hopefully have better information next week on that part here.
Okay, thank you.
You're welcome. Any other questions?
Yes, Dr. Kumar, it's Lisa again. Did you say that you tested 30,000 people within your health?
No, I did not. No, I did not.
Okay.
That was 3 times I said a hypothetical scenario. No, we did not test 30,000. We are not intending to test 30,000 as well. We just have a capability of testing people with antibody testing.
And Dr. Kumar, what is your belief on what percentage of the population should be tested? Some of the countries that have shown great success in containing it have been testing a random population. Is it just the people that are showing symptoms, or should we test more widely?
You know, this is a very complex epidemiological question. I'll answer to my best of my ability. Generally, we would like, hypothetically, and most likely, when we comment that we have 100,000 people positive getting on the current testing in the United States, you can multiply the number about 5 or 6 times. These are the amount of people who probably have the COVID exposure. We just haven't tested them. So ideally, we would need several 100,000 testing in the community to be done to understand. Now, I want to make sure we understand, but the testing has to be coupled with 2 other things. One is the contact tracing, and the number 3 is isolation precautions and social distancing. So we have 3 measures. Those countries are able to do a much better job of containing the disease. I'll give you an example of Germany. Some of the areas in Germany, the testing has been significant. About 3 to 4% of the population, general population, has been tested in many areas. But if you couple with a contact tracing and a strict isolation measure, you're able to understand what part of the society, what part of the community has the outbreak or a possibility of spreading the infection. You can contain and manage them differently. And that is one way of managing the pandemic. And then you can open parts of the economy, parts of the business on that part here. In the United States, we have actually not tested enough. If you look at the numbers across the system, and you hear all sorts of numbers, within in Connecticut, we have not tested enough. I like to think we need to be testing at least 50, 60,000 people every day. That's a lot of patients that you should be testing. We have a 3.5 million population. If you test at least 10% of the population, we would have a good sample size of where would that be. But I think we're way behind in that testing.
Thank you.
We have one question on
Sure.
Facebook regarding elective surgeries and when they might start up again.
I do want to make a comment. The Hartford Healthcare continues to remain open for urgent and emergent surgeries. We are obviously looking at any patients who requires a surgery at this time, and we're assessing them, and we're making sure that those patients get the right care and appropriate safe setting at this time. We continue to evolve and continue to reevaluate when do we start doing elective surgery at this time. I think it depends on a lot of factors. It depends on what the governor's mandate is going to be, how the governor is going to be positioning the social distancing measures and other part of the business come back. The second part is that how our PPE supply is going to be maintained. We want to make sure healthcare providers and our patients are protected when we go back to elective surgery. We also want to make sure that we see some sort of a decline on our disease activity in the state of Connecticut. And there are several factors which will determine when we are going to be going back to elective surgery. As of today, Hartford Healthcare has not made a decision when that might be. But we're evaluating almost on a daily or every other day basis, and we will shortly inform as soon as we know where we are on that part. Anything else?
When will nursing homes be open to patients?
When will nursing homes be open to patients? Nursing homes are open to patients, as best I know. Hartford Healthcare has 3 nursing homes and 4 assisted living, and we are open. I like to believe most nursing homes are open as well. I can't comment because a lot of nursing homes are not managed by Hartford Healthcare. However, the state has done a good job of assigning some of the nursing homes where the COVID positive patients or patients actually who have been leaving the healthcare organization can go back. I'd like to commend Commissioner's effort and the governor's effort on the nursing home side at this time. That's it. Very good. If there's no further question, we'll adjourn for the day. And thank you very much for your time. And I appreciate all the hard work everybody in the media does and all the members in the healthcare community is doing at this time. Thank you.